Alright, so in this video I'm going to talk about my first visit with my pulmonologist, I guess the lung doctor. I had the visit because I have diffuse systemic sclerosis, and I was referred to the doctor from my rheumatologist. With the disease, you can actually have issues where there's a progression of lung, or there's an issue with your kidneys. There's different things that can happen. In my issue, I have interstitial lung disease that was found by my rheumatologist, and that's why I'm getting the visit there. So let me tell you what happened. When I went to the visit, I ended up having to do a spirometry test in the beginning, right before seeing the doctor. And it was very hard for me to do the test. It was difficult for me. I ended up taking the test, and after that I was led to another room to go and visit with the doctor. Well, the doctor that came in wasn't the main doctor, but it was the one assisting him. It was a woman, and she basically took my backstory and learned about my recent ER visit. Now, my recent ER visit was in, May. It was in May, and that visit had to do with a breathing issue, I believe, because they had thought originally it was the heart, and they ruled out that it wasn't the heart from what they saw. So they assumed it had to be the scleroderma and had something to do with the lungs. At that point, they knew that I would be going to see this doctor in the next 2 weeks, and so once they gave the all clear, I was allowed out and told that I need to follow up with my primary care doctor, and end up going to that lung doctor visit, pulmonologist. Anyway, back to the doctor visit. So at the doctor visit, she gets my information. I let her know a few things that have occurred. Let her know about, of course, the ER visit. And I let her know about some issues where I've been having problems being tired, and I've been having problems with, well, let me give this example. I ended up having a walk last week with someone from my house to the grocery store. And I was originally going to go to a store and stop, but the person with me said, "Come on, let's go to the store." It's okay. The length for the store from my house is at about a mile. It was hard for me to walk all that way, and I realized I probably should have stopped earlier. It was a struggle. I told the person I was with that you don't know how hard this is. And I kept walking. Once I ended up going to the store, at that point I had to use a scooter to maneuver around the store. And I did not walk back home. I took a bus back home. That's how tired I was. It was not good. So I let her know about that. Let her know about some other issues. And she went and took the information, decided to go to discuss it with the doctor who would be coming in shortly. That doctor came in. It was a very short visit. He told me that the data that I had prior, because I apparently had a spirometry test prior, maybe about 2 to 3 months ago, that was fairly similar to what I have now. So he couldn't point to any data that would back up why there was an issue with the ER. He couldn't point to any data that would explain why I was tired in that walk from my house to the grocery store. And he volunteered 3 options. First, they're going to give me a referral so that I can do a sleep study for apnea. Second, they're going to have a pulmonary rehab referral where I'll be going for therapy for that for several weeks. And I was told later by a nurse that people who go to this pulmonary rehab can feel better But once you stop the exercises they provide you or what you learn, it'll come back. It won't feel as good as before, so you need to keep up on it. The third thing the doctor stated was that because I have this disease, because I have systemic sclerosis, it's a very hard condition to have. There may be some sort of anxiety playing with it. There could be an anxiety issue, maybe, and he said possibly anxiety depression, that's playing into the situation. I'm guessing he's saying, you know what, I would talk to he told me to go talk to my primary care physician, let them know, and then also make sure you seek a recommendation for a counselor. And they gave me an opportunity to speak to a person there who was a caseworker. At that point, the visit, I asked a few more questions. He reiterated he could not tell me why I was so tired in that walk that I had. There was nothing that could point to that because the data was what it was. So after that was done, I spoke to the nurse, as I said earlier, and then after that, I ended up seeing if I could get in contact with the case manager to see if I could get a referral, some sort of information about possibly looking to a counselor. And I was not able to contact that person. They were not able to get in contact with that person. What happened is I was going to receive an email later. Let's see if that happens. They would put me in contact with a counselor. I decided to be proactive, and I decided to contact my doctor and determine that this is what I was told at my pulmonologist visit, and I'd like to see if I can get a recommendation or referral to speak to a counselor. Let me tell you my take on this. I am disappointed that the ER visit I recently had last month, or at least 2 weeks ago now, could possibly happen again, because I thought I was going to receive maybe like a drug for the lung or maybe a shot or something. They could tell me what I could do. And besides the apnea, which would be part of the tiredness that I have, or the pulmonary rehab, those are the two opportunities that were afforded to me. So this is not going to be a quick fix. This is not something, hey, you just take this pill and you're done. You won't have to go to the ER back again. The second thing is, I was honestly shocked that they would just say, because you have this condition, it's a hard condition to have, and you may need to speak to someone about, like a counselor about it. So they're trying to say, hey, maybe the reason is because you have anxiety or depression. I don't think that having this condition necessarily means you do have anxiety or depression. I know that it is a possibility, just like with multiple sclerosis. It is definitely a possibility you could have it just because it's a hard condition. But I don't think you should presume that someone has it, and that explains why they're having an issue being so tired and walking to a store and having to use a scooter. That I don't think explains it. But I'm willing to try what is recommended, and I'm looking to see if I can get an appointment with someone, if my doctor allows it, to speak to a counselor. And I'll give it a try. If that's what he really suggests, I'll give it a try. A part of me thinks, the next time I end up in the ER, because I was told by my primary care doctor this could happen again in 10 days or could happen again in 10 years. If it were to happen sooner than later, do I just go and tell my... do I just go tell the ER doctor, hey, my pulmonologist, I did see him, but he thought it was depression, and maybe that's why I'm here at the ER. What? It is it? Okay. I feel really bad for people who have a condition like this, or have a tough condition, especially like multiple sclerosis, who get told before or prior to learning they do have the condition that's depression or that's anxiety, because I'm sure that there's plenty of people who do get told that until they find out about the actual condition. I've never been told by my own primary care doctor or any of the ER doctors that were involved in my care for my last visit that they thought that it was something that had to do with anxiety or depression. My primary care doctor has been treating me for years. Never did this come up. The ER doctors, and look at my file, no one ever brought up a possible anxiety issue, depression, nothing. What I'm worried about is that this will result in another ER visit that's going to cost me a lot of money because this wasn't taken care of beforehand. As I said, I'm going to take his recommendation. I don't know how it's going to work out, but I will take the recommendation because I am not interested in going back to an ER visit like the one I had last time. Be aware if you have this condition that they're going to assume, rightfully or wrongfully, that you do have anxiety and depression. That doesn't mean it's true. So I will update you later when they find out what it is.